Hey everyone! Today we're talking about something that affects millions of people worldwide, but often goes unnoticed until it's too late. High blood pressure, also called hypertension, is known as the silent killer for a reason. But here's the thing, your body does give you warning signs. And today I'm going to share 8 symptoms that you should never, ever ignore. If you or someone you love has high blood pressure, this video might literally save a life. So let's get started. Symptom 1. Headaches. Number 1. Persistent headaches. Do you wake up with headaches? Especially in the morning? This could be your first warning sign. When your blood pressure is too high, it puts extra pressure on the blood vessels in your brain. This creates a throbbing, pulsating pain, often felt at the back of your head and neck. Here's what makes these headaches different from regular ones. They're worse in the morning when you wake up. They feel like a tight band around your head. Regular painkillers don't really help unless your blood pressure is controlled. Red flag alert if you get a sudden, severe headache that feels like a thunderclap. Especially with blurred vision or chest pain, call emergency services immediately. This could be a hypertensive crisis. The bottom line? Don't just pop a painkiller and ignore it. Check your blood pressure and talk to your doctor. Symptom 2. Dizziness. Number 2. Unexplained dizziness. Feeling dizzy, lightheaded, or like the room is spinning. This is your brain telling you something's wrong with your blood flow. High blood pressure messes with your brain's ability to regulate blood flow properly. When your BP spikes or drops suddenly, you feel dizzy. You might experience feeling faint when you stand up quickly. A spinning sensation like you're on a merry-go-round. Feeling unsteady while walking, almost passing out. Why is this dangerous? Dizziness increases your risk of falling and getting injured. But more importantly, it could signal that you're at risk for a stroke, or what doctors call a mini stroke. If your dizziness comes with slurred speech, weakness, or vision problems, don't wait. Get to a hospital immediately. Symptom 3. Nosebleeds. Number 3. Frequent nosebleeds. Random nosebleeds without any obvious reason. Your blood pressure might be to blame. Your nose has lots of tiny, delicate blood vessels. When your blood pressure is too high, these vessels can rupture and cause bleeding. Most people get nosebleeds from dry air or picking their nose. But in people with high blood pressure, they happen out of nowhere. Sometimes, even during sleep, warning signs, nosebleeds that happen frequently, heavy bleeding that won't stop after 20 minutes, nosebleeds along with headaches or dizziness. What to do? Sit up straight, lean forward, and pinch your nose for 10 to 15 minutes. Don't lie down, and definitely check your blood pressure right after. If nosebleeds keep happening, see your doctor. It's your body's way of saying your BP is dangerously high. Symptom 4. Vision problems. Number 4. Vision issues. Your eyes are like windows to your blood vessels, and high blood pressure damages those tiny vessels in your retina. You might notice blurry vision that comes and goes, seeing double spots or floaters in your vision, sudden vision loss in one or both eyes, sensitivity to bright lights. This condition is called hypertensive retinopathy. And here's the scary part. If left untreated, it can cause permanent blindness. Emergency alert. If you suddenly lose vision, see flashing lights, or have eye pain with high blood pressure, this is an emergency. Get help immediately. The good news? Regular eye exams can catch this early. If you have high blood pressure, get your eyes checked every year, even if your vision seems fine. Remember, protecting your eyes means controlling your blood pressure. Symptom 5. Chest pain and shortness of breath. Number 5. Chest pain and trouble breathing. This is where things get really serious. High blood pressure makes your heart work overtime, like an engine running in overdrive. Over time, This damages your heart and can cause chest pain or pressure, sometimes spreading to your arm, neck, or jaw. Feeling like you can't catch your breath. Difficulty breathing when you lie down. Getting winded from simple activities like climbing stairs. Why does this happen? Your heart muscle thickens from working too hard. The arteries that feed your heart get narrower. Less oxygen reaches your heart, causing pain. Critical warning. If you have chest pain with sweating, nausea, or pain radiating down your arm, this could be a heart attack. Call emergency services now. Don't wait. Even if it's just mild chest discomfort with high blood pressure, get it checked out. Better safe than sorry. Symptom 6. Irregular heartbeat number 6. Heart palpitations. Ever feel like your heart is racing or pounding in your chest? Skipping beats or fluttering? Beating irregularly? High blood pressure changes your heart structure and electrical system. This can trigger dangerous heart rhythms, especially something called atrial fibrillation, which dramatically increases your stroke risk. Some palpitations are harmless, but in people with high blood pressure, they can be a warning sign of serious heart problems. Get help if palpitations last more than a few minutes. You feel dizzy or faint with them. You have chest pain along with irregular heartbeat. Don't ignore this symptom. Your doctor might need to do an ECG to check your heart rhythm. Symptom 7. Stroke warning signs. Number 7. Stroke-like symptoms. This is the most critical section. High blood pressure is the number 1 risk factor for stroke. Remember fast. F. Face drooping. One side of the face droops or feels numb. A. Arm weakness. One arm feels weak or numbs. Speech difficulty, slurred speech, or trouble understanding. Time to call emergency. Other stroke warning signs. Sudden numbness on one side of your body. Sudden confusion or trouble understanding. Vision loss in one eye. Severe dizziness or loss of balance. Here's what you need to know. Even if these symptoms last only a few minutes and go away, you must get medical help. These mini strokes or TIAs are your final warning before a major stroke. People with high blood pressure are 4 to 6 times more likely to have a stroke. Every minute counts. Conclusion and action steps. Final thoughts. 8 warning signs of high blood pressure that you should never ignore. Persistent headaches, dizziness, frequent nosebleeds, vision problems, chest pain and shortness of breath, irregular heartbeat, stroke warning signs. Here's what you should do. Right now, monitor your blood pressure regularly. Get a home monitor. Take your medications exactly as prescribed. Don't skip doses. Reduce salt in your diet. Exercise regularly. Even just walking helps. Manage your stress. Quit smoking and limit alcohol. Remember, high blood pressure might be silent, but when it speaks, you need to listen. These symptoms are your body's way of screaming for help. Don't wait until it's too late. Prevention is possible, and it starts with awareness. If this video helped you, please like, share, and subscribe. Our next video is about the hypertension diagnosis. Thank you for watching.